Hello, welcome to Zigmatech Learning Hub. I'll be your instructor for civic education. For this class, we are going to be taking our exercises from the Examguide app. If you don't have the application already installed in your device, I want you to download the app in order to follow along in this class. Examguide is the leading educational app that helps students prepare adequately for various exams like UTME, post-UTME, WAEC, GCE, KCPE, IJMB, JUPEB, Calvipedia, BESE, SSCE, NCEE, NECO, etc. You can download the app from www.examguide.com or Google Play Store. Please subscribe to our channel and turn on the notification bell to be updated on new videos. Ready for today's class? Okay, let's get started. In today's class, we are going to look at one of the main emerging issues in our society. You know, in civic education, we expose you to the emerging issues in our society, and one of them is what we are going to discuss today, which is HIV/AIDS. Now, by the end of this lesson, you should be able to explain the meaning of HIV and AIDS, discuss the modes of transmission, the causes, what we call the causes of HIV/AIDS, study the symptoms of HIV/AIDS, discuss the effects of HIV/AIDS, highlight the solutions, how we can stop HIV/AIDS, discuss the concept of HIV/AIDS stigmatization, and reasons for HIV/AIDS stigma. So go on with us and see what we discuss. Now, meaning of HIV/AIDS, what does it mean? HIV/AIDS is an acronym that symbolizes human immunodeficiency virus, which is a type of virus when transmitted through body fluids, attacks, weakens, and destroys the white blood cells and make the person develop AIDS. Now, HIV is a virus, and this virus is the type that when it transmits into the body through the body fluids, it stays in the body fluid, especially blood, and what it does is to attack and destroy the white blood cell, that is the body immune system. So understanding that HIV is a virus, and what this virus does is specializes in attacking and destroying the white blood cell, that is the antibodies, the body immune system. That's what the virus does. Now let's look at AIDS. AIDS is an acronym for acquired immunodeficiency syndrome. Now, AIDS is a condition where the body immune system has been completely destroyed and the body becomes vulnerable to diseases. So it's a situation, it's a condition, that's why we call it a syndrome. It's a condition where the body immune system that helps to fight off any form of disease that attacks the body, when it has been completely destroyed and the body becomes exposed to different kinds of diseases, that any disease that comes in contact with the body will not be able to put up resistance against such disease. And the HIV, if it is not taken care of, an HIV patient is careless, it will transform to AIDS. It will lead to AIDS because HIV will continue to attack the body immune system, and once it has completely damaged and destroyed the body immune system, then the person will now acquire AIDS. That he will now develop this condition that the body will not be able to resist any form of disease because the immune system has been completely destroyed, and in such case the chance of survival is very minimal because the person in most cases will die at this condition. Now let's look at the modes of transmission, the causes of HIV/AIDS. Now HIV/AIDS can be transmitted when one has what we call unprotected sexual intercourse, especially with a patient of HIV, somebody that has HIV. If you have unprotected sexual intercourse, that's sexual intercourse without any form of protection, like condom. Also, blood transfusion can cause HIV, can lead to the transmission of HIV if the blood is not properly checked, screened before transmission. And that is why before they do any blood transfusion in the hospital, they must test the blood to be transfused to the patient. They must test it. So it can occur if the blood involved is not tested and is coming from HIV patient. Of course, that one is 100%. Now, mother to child. A mother can transmit it to the child through breast milk, during childbearing, during pregnancy. The mother can transmit. Now, sharing of needles, razor blades, syringe, all these sharp objects that can pierce the body. So it's a risk, actually. So when HIV patient is involved here, it can transmit HIV. Now, using unsterilized medical or piercing instruments. Now, when people use unsterilized medical instruments, that is why in the hospital, all these medical instruments, they sterilize them or they dispose them after usage. Now, kissing a person with a bleeding gum can cause HIV. When you kiss somebody that has bleeding gum, HIV actually does not inhabit in saliva. But if a person has bleeding gum and you give a person what we call a hot kiss, it can lead to transmission of HIV because there will be exchange of blood here. Now, open wound of an infected person, when you come in contact with such person, open wound, especially a fresh one, can lead to transmission of HIV. Now, these are the major modes of transmission of HIV. Now, ways of not contacting HIV. You know, people have various misconceptions about HIV/AIDS. Now, you must know that HIV cannot be transmitted by insect bites, like mosquito or any other insect. It cannot bite a patient or somebody that has HIV and bite another person. It cannot be transmitted through that way. Otherwise, most of us in Nigeria or Africa and most African countries, we have HIV as a result of mosquito bite. Sitting on the same, sharing the same toilet seat cannot lead to transmission of HIV. Even kiss, peck, the one I talk about, hot kiss, when a person with a bleeding gum is involved. Now, sharing of cutleries, using the same cutlery with a person cannot lead to the transmission. Then touching, hugging cannot lead to transmission of HIV. Of course, HIV does not inhabit in sweat, does not stay there. Now, let's look at the symptoms of HIV. Now, when AIDS begin to develop, there are certain symptoms that can show. Now, one is anemia, that is slow movement of irregular movement of blood, and pale. The person will become pale because of lack of blood. Now, the person can have distorted or blurred vision as a result of it. Now, it can lead to swollen limbs of glands of the person. One of the symptoms is nausea or vomiting of the patient. The person will begin to vomit. Now, the person can have mouth, genital, or anal sores. Now, there could be chronic fatigue or depression or weakness. The person will become unexplainably weak. It can lead to chills. The person feel cold. Now, there could be shortness of breath. It can lead to that. One of the symptoms is loss of appetite. The person will not have this zeal to eat, will not like to eat. It can lead to nose, mouth, or genital bleeding. The person can bleed through these openings. There could be frequent diarrhea. Person use the toilet frequently. Dehydration, the person will lose water in the body. There could be tuberculosis or dry cough. It's one of the symptoms. Pneumonia and persistent fever or headache can also be a symptom of HIV. The person can weight loss or emaciation can occur. As a result of this, as a symptom, recurrent skin infections or rashes can also be a symptom. Excessive sweating at times in the night can be a symptom. Recurrent fungal infection in the mouth or throat can be a symptom of HIV. Now, aching muscles and the joints can be a symptom. Hepatitis B can develop. Then loss of memory, that is amnesia, can also occur. But you must know this. These are symptoms, but these symptoms are not peculiar to HIV/AIDS. No. The best way to know whether a person has HIV/AIDS is through tests. It is tests that will determine, not symptoms, because some of these symptoms can occur even when the person does not have HIV/AIDS. So you don't go and begin to stigmatize somebody that has any of these symptoms. No. The best way to know is through tests. Now, let's move ahead. Let's look at the effects of having HIV/AIDS. Number one is what we call stigmatization. We're going to discuss this in detail. Stigmatization is about discrimination against people living with HIV/AIDS. When people treat them, isolate them, is what we call, it can lead to that on the patient. It can bring disgrace to the family and the society. Of course, the family name can change as a result of that. People will now reference the family as a family that one of the members have HIV. So HIV can be the name of that family. So it can bring shame, disgrace to the family and even the society where it's taking place. It can lead to loss of means of livelihood. How? Some employers, if they discover that their worker has HIV, they can ask the person to go because it's a life-threatening disease. So it can make a person to lose his or her means of livelihood, that is the job the person is doing. It can lead to poverty. When this person has lost means of livelihood and needs to treat himself, taking antiretroviral drugs, which at times is expensive. So it can lead to poverty on the part of the victim. It can lead to increased budget of the nation because it's a menace, it's an emerging issue, it's a civic problem. Now, the country, we have no choice than to fight and combat HIV spread and contain the disease in the country. By doing that, the budget will increase. Also, it can lead to depression or low self-esteem on the victim of HIV. The person that has HIV, the person will feel depressed. As a result, the person will withdraw his or herself at home, withdraw, because, of course, people at home will not like to associate with the person. It can lead to broken homes in marriage. Now, there could be a situation where a spouse, a husband has it, the wife does not. Or the wife, especially the wife can have without the husband having it. Now, when one discovers this and discovers that he or she, the other one is negative, of course, that marriage can break. In most cases, the marriage will not continue. So it can lead to broken homes or divorce in marriage. It can lead to death. Of course, when it gets to AIDS, the person is most likely to die. So it can lead to untimely death and even increased death rate in a nation. Also, it can increase dependency on family and the society. Now, this person who has HIV and as a result lost his or her job will begin to depend on other members of the family and the society. So it will increase dependency ratio in a country. Also, there will be high dependence on drug. It will lead to that. The reason for high dependency on drug is because you have to depend on antiretroviral drug throughout your life because, of course, HIV is not curable. You cannot remove it from the body. It will be there, but you can use the antiretroviral drug to hold it from acting on your immune system. So the person will have no choice than to depend on this drug throughout his life. Can lead to poor academic or job performance because of depression, low self-esteem, withdrawal. The person even developing symptoms of HIV/AIDS can make the person to begin to drop in academic performance. That's when the person is a student, or job performance if the person is a worker. It can bring about loss of reputation or shame on the person. The person will lose because people will see the person as an irresponsible person, and the person will always feel ashamed of his or herself. Now, let's look at preventive measures against HIV/AIDS. How can we prevent or stop HIV/AIDS? Now, we can do this by abstinence from sexual intercourse. Complete abstinence. Don't involve yourself in any form of sexual activity. It will help to prevent that. Then faithfulness to one's partner. Be faithful to your spouse. Don't have multiple sexual partners. Maintain only that of your spouse. It can help to prevent HIV/AIDS. Then having protected sex. If one must indulge in sexual intercourse outside the person's partner, now medically it is required that the person should ensure that sexual intercourse is protected through the use of condom. Now, sterilization of body piercing objects in hospitals and other institutions. All these like syringe and other body piercing objects, even the clipper, they should be sterilized. Also, we can destroy used needle, syringe, and other equipment that pierce the body. We can destroy them after use so that it won't be used by any other person to avoid infection. Now, avoid contact with body fluids like blood. Avoid it. Contact with other people's blood. Avoid it. Then there should be education and awareness program. There should be education and awareness program to actually enlighten people about HIV/AIDS. And I must mention here that there is a day set aside for education and creation of awareness on HIV/AIDS, and also sympathize and mourn those who have died as a result of HIV/AIDS. And that day is called World AIDS Day. That is every 1st of December. 1st of December, World AIDS Day. So it's a day set aside to create awareness programs. So this awareness program can also be inculcated in school curriculum, which is what we're doing now. Then we can encourage people to go for counseling and testing, because people are afraid to check their HIV status. So people should be counseled to know and see the need to check their HIV status. Now, let's look at how to manage HIV/AIDS. How to manage it. Now, just when somebody has it, what should be done to help the person? Now, taking recommended drugs as prescribed. The person should take the recommended drug, the antiretroviral drugs, as has been prescribed by medical practitioners. The person should always eat a balanced diet to help the body immune system, which is being attacked by HIV virus. Now, staying positive about survival. The person should not see that having HIV is end of life. The person should be positive, stay positive about life. Then the person should always exercise. Is another way to manage. Exercise should be done. Then stigmatization of people living with HIV/AIDS should be discouraged by government, family, religious institution, and every other groups in the society. Then the treatment and cost of treatment should be subsidized by the government. Thus, the government should reduce the cost of treating HIV patients. Also, people should go for counseling, especially when they have it. People should go for counseling so that they'll be educated on how to live. Also, early discovery of one's status will get a long way to help manage it from the onset, because if you don't know and allow it to develop into AIDS, your life, you may not survive it. Then there should be awareness program at all time to help people, both that have it and both who don't have HIV. Now, let's look at the concept of HIV stigmatization. What does it mean? It's simply discrimination and ill treatment or special treatment against people living with HIV by other members of the society. Now, this is a situation where people isolate them. People don't want to associate with them. People don't want to come in contact with them. People don't want to even take handshake from HIV patients. People talk down at them. So any form of ill treatment against people living with HIV, we call it stigmatization of people living with HIV AIDS. Now, let's look at reasons for HIV stigmatization. Why do people stigmatize people living with HIV AIDS? One, ignorance of the mode of transmission. Now, because people do not understand or are not enlightened about HIV AIDS and modes of transmission, they feel that because you have HIV, you have unnecessarily involved yourself in irresponsible behaviors. So it's because of that ignorance that make people to stigmatize them. Also, religious belief and myth. Now, there are people that have this misconception, this myth about HIV. There is this story that HIV is a curse from God against sinners that engage in immorality. So, meaning that any patient of HIV is automatically seen as somebody under the curse of God, and therefore the person should not be sympathized with. The person does not deserve any sympathy or empathy from people. So it's another cause of HIV/AIDS stigmatization. Also, another reason is HIV is associated with already stigmatized behaviors in the society, like lesbianism, homosexuality, infidelity, womanizing, prostitution. So it is associated, people associate it with already stigmatized behavior. So HIV, if you have HIV, so to people it already means that you are involved in these irresponsible behaviors or behaviors that are already stigmatized. If it's a woman, people will see you as a prostitute automatically, whether it's transmitted through other means other than sexual intercourse. Now, nature of the disease is also another cause of stigmatization. The disease itself is terminable. It does not have a cure, and nobody wants to come in contact with that disease that does not have any cure. Also, fear of death. People are aware that HIV can lead to death. People can die as a result of HIV when it develops to AIDS. So people fear that they will die if they contract it, and that is why they discriminate and don't associate with people that have HIV. Also, the high cost of treatment. People are aware that to manage HIV is it's capital intensive, let me put it that way. It costs a lot to actually treat HIV and manage it when a person contracts HIV. So people don't want to go into that. Also, self-protection consciousness. People want to protect themselves from danger, from such kind of disease. So that consciousness of self-protection, I want to protect myself from this kind of disease, also lead people to stigmatize people that have HIV/AIDS. Also, fear of infection. People don't want to be infected. So that is why you see some people, they will not actually associate with those that have HIV. They won't want to shake them. They won't like to hug them. Also, inadequate information and awareness. When there is inadequate information, people are not getting adequate information about this HIV, can lead them to stigmatizing people that have HIV/AIDS. Because if you're aware, you will know that shaking somebody cannot make you to have HIV. Even hugging the person cannot make you have HIV. Sitting close to the person, of course, you cannot contract HIV through this means. Also, another reason is people living with HIV/AIDS are seen as irresponsible people in the society. So, to them, HIV AIDS is as a result of one's irresponsibility and irresponsible behavior. So these are the reasons people stigmatize those living with HIV/AIDS. Now let's do a practice section with our exam guide on the topic we have done, that is HIV/AIDS. So we select the subject, which is civic education. For here we select at random. Then the topic of interest, we're interested in HIV. You can see we have clicked it, HIV/AIDS, HIV/AIDS. This is how the app works. Now click OK. Now I click Get Started. Now I'll see questions relating to the topics we have done. Now, being faithful in marriage can greatly assist to prevent what? Of course, HIV infection. We talked about being faithful to one's partner. Now, one habit with people living with HIV/AIDS must avoid to remain healthy and productive is A, regular contact with healthy people, self-pity and self-medication. We say one habit they must avoid is self-pity and self-medication. They shouldn't pity it because it will lead to depression. Now, self-medication, abuse of drug, and of course they may not be. So it's not participation in profitable ventures. It's not pursuit of academic study. We encourage them to do all this, but not self-pity and self-medication. Also, which of these cannot be responsible for the spread of human immune deficiency virus or acquired immune deficiency syndrome? One, which of these cannot be responsible for the spread? Now, unprotected sexual intercourse is responsible for the spread. Now, dining and drinking with people living with HIV people is not responsible, and it cannot be responsible. Using unscreened blood transfusion, of course, you will get it. Sharing of unsterilized objects, of course, it can lead to the spread. Now, look at this question. To prevent the spread of HIV/AIDS, people should be encouraged to A, avoid casual sexual activities. 2, marry very early in life. C, engage in gainful employment. C, pursue higher education. People should be encouraged to avoid casual sexual activities, that is abstinence. Now, testing of blood before transfusion will greatly help to A, spread HIV, of course it won't, control HIV, eradicate, prevent. It will help to prevent HIV. Now, World AIDS Day is observed when? I mentioned it on 1st December. That's the day we carry out our awareness campaign against HIV and commemorate with those who have lost their lives as a result of HIV. Now, which of these is not a form of stigmatization? Now, refusal to interact with family of an HIV patient, physical and verbal abuse of HIV patient, ostracizing HIV patient, enlightening people living, of course, the enlightening people living is not a form of discrimination against them. Thank you for participating in today's class. You can practice more questions using the Examguide app. The app scores and gives a detailed explanation of all questions at the end of your practice tests. You can learn a particular topic of interest with different modes like study mode, mark mode, and the practice mode. It also has other features that make learning fun. It is a must for all serious students. Download from www.examguide.com if you don't have it yet. See you in the next class. Don't forget to subscribe to our channel, hit the notification bell, and share the videos to people that benefit from it. Bye.